Today we're going to talk about everything male pattern hair loss or typical men hair loss. What is causing it, why we're getting it, who's getting it not, and what are the treatments. Keep on watching. Hi, I'm Dr. Parsa Mohebi, Medical Director and founder of Parsa Mohebi Hair Restoration. Hi, I'm Dr. Parsa Mohebi, a hair transplant surgeon based in LA and San Francisco. Today I'm going to talk about male pattern hair loss and how it can affect men and women. Male pattern baldness is a phenomenon that has to do with your gene and the hormones that some of the hairs in certain part of the scalp are getting miniaturized, getting smaller and smaller to the point that they're not visible, and then we lose them finally. So people are keeping certain part of the hair, usually in the back and sides, in a healthier, better shape, and losing certain areas like front, crown, and top areas. We get male pattern hair loss because we have the gene for it. So if you are prone to male pattern hair loss, your genetic dictate that some of the hairs that you have are more sensitive to the hormone dihydrotestosterone. So if you're a man, testosterone gets converted to dihydrotestosterone, and dihydrotestosterone keeps working in damaging your hair until you go bald in those areas. Male pattern baldness does not only happen in men. In fact, the biggest cause of hair loss in women is male pattern baldness, not female pattern hair loss. How to protect male pattern baldness is not difficult. You just need to look at your family members, and if you're a young man in your early 20s or 30s and you see the corners are going back, you have to go find somebody who was just like you at your age. If your father, you have some pictures at about your age, and he has the same pattern of hair loss, and now he's going all the way back here and completely bald, you are probably going to go there. So that's one way of predicting. The other way is to find a good hair transplant doctor and come and get a microscopic evaluation. With microscopic evaluation, we know exactly in which areas you have miniaturization or active hair loss, and that predict where you're heading with your hair loss. We usually combine family pattern and microscopic evaluation results to see where patients are going. Treatment of male pattern baldness is medication. We have certain medications like Rogaine and finasteride that can prevent male pattern hair loss, or if you have male pattern baldness, they can make the hair a little bit thicker or coarser in certain areas that are fine already. And if your hair loss is to the stage that it's irreversible with medication, you can do a hair transplant. Hair transplant is removing hair from certain areas that you have more permanent hair and put them on the balding area. I hope I was able to answer some of your questions about male pattern hair loss and how it can affect men and women. If you have any other questions or comments, put them in the comment section on the video. Also, make sure you follow us on social media if you want to learn about the newest techniques in hair restoration procedures.